Hello, my name is Dr. Dewan S. Raja. Today I will discuss about 5 multiple choice questions on a neurological disease. Let's start. Question number 1. A 32-year-old woman presents with a history of intermittent visual disturbances, numbness and tingling in her limbs, and difficulty walking. On examination, there is evidence of optic neuritis, weakness in the lower extremities, and brisk reflexes. Magnetic resonance imaging reveals periventricular lesions with gadolinium enhancement. What is the most likely diagnosis? These are the choices: amyotrophic lateral sclerosis, ALS, Guillain-Barré syndrome or GB syndrome, multiple sclerosis, myasthenia gravis, lateral medullary syndrome. Okay, so what is the correct answer? Correct answer is what? That is C. C is the correct answer. Multiple sclerosis. Okay, let's go to the second question. A 45-year-old man with a known history of relapsing, remitting multiple sclerosis presents with a sudden onset of weakness in his right arm and leg. The weakness has progressed over the past 24 hours. There is no associated sensory loss, and he denies any recent infections or illnesses. On examination, there is spasticity and hyperreflexia on the right side, and Babinski sign is positive. What is the most appropriate initial management of this patient? These are the choices: high-dose corticosteroid, intravenous immunoglobulin, plasma exchange, plasmapheresis, symptomatic treatment with muscle relaxants, and interferon. So, this is a management of acute on chronic multiple sclerosis. Answer should be what? It should be A, high-dose corticosteroids. Okay, question number 3. A 32-year-old female presents with episodes of blurred vision, double vision, it is also called diplopia, and difficulty walking. She reports these symptoms coming and going over the past few months. On examination, you observe nystagmus, there is involuntary oscillatory movement of the eyeball, and there is positive Romberg sign. She also mentioned experiencing tingling sensation in her limbs, an electric shock-like sensation that radiates down the spine and into the limbs upon neck flexion. What is the most likely clinical sign observed in this patient? Okay, what is that clinical sign? This patient, what is his diagnosis and what is this clinical sign? Patient has episodes of blurred vision, double vision, and difficulty walking. So these are the choices: hypertension, hyperreflexia, hemianoxia, Lerner's sign, hyperopia. What is the correct answer? Correct answer is Lerner's sign. Okay. Now we'll go to the question number 4. A 45-year-old male complains of weakness, numbness in his legs. His symptoms had been progressing gradually over the past year. Upon examination, you notice weakness in the lower extremities increase muscle tone, brisk deep tendon reflexes, stimulation of the lateral plantar aspect of the foot leads to extension, dorsiflexion, or upward movement of the big toe. There is the hallux. Big toe also called great toe. What is the likely clinical sign observed in this patient? Okay. Question number 4. Choices are clonus, B. Babinski sign, C. Lehermite sign, D. Hemiplegia, E. Flaccid paralysis. What is the correct answer? Answer should be Babinski sign. Okay. Question number 5. A 38-year-old woman with relapsing remitting multiple sclerosis RRMS is stable on disease-modifying therapy. She is concerned about long-term management of her condition and asks about lifestyle changes. So, female, 38 years old, relapsing remitting multiple sclerosis. Which of the following health education recommendation would be most appropriate? High intensity aerobic exercise in 60 minutes daily, B. Regular exposure to hot baths and saunas, C. Moderate intake of red wine, D. Consumption of low fat diet, E. Adequate vitamin D supplementation. What would be the answer? Prevention and long-term management of multiple sclerosis by what? Answer should be E. That is the adequate vitamin D supplementation.